We live in interesting times, in the times where different networking setups coexist at the same time. The legacy setup and the newer setup. The legacy setup is all about having every system available within one institution. So that means one hospital would have their own PACS, would have their own RIS, EMR, things of that nature. That is the older, the legacy setup, but it's still very much so alive, and we'll still see it in clinics, for example, quite commonly. The newer setup is the enterprise one. Enterprise deployments mean that there are systems that are shared, sometimes just one, maybe a shared PACS, maybe a shared EMR, sometimes more than that. Sometimes there's a bunch of systems that are all shared. It gets to be pretty complex, but it also pays the dividends. Now, the interesting part, though, as I said, that both kind of still exist. So depending on where you work, you might see one or the other. In this video, what I'm going to do is I'm going to build out the legacy network configuration using our training labs network workflow diagram builder. So let's do just that. Let's look at a situation where we have a patient walking into a clinic. Okay, so as a patient walks into a clinic, they would have a requisition, probably handed to them by their family physician, which actually is the document that authorizes the clinic to actually do the test itself. So that's fine. Now, what's going to happen is that they're going to walk into that clinic and they're going to go over and talk to the receptionist first. Now, that receptionist is going to take their requisition and they're going to enter this in their radiology information system. And that is how we're going to get this order digitized. Now, once that order is digitized, ultimately, and you always want to think about this in terms of workflow. What would be the next step? Well, the next step would be the actual acquisition itself. But let's not jump to bringing the patient into the room quite yet. Now, remember that we've entered everything in the radiology information system, but the language, if you will, of that radiology information system is HL7. This is not the language that the imaging devices would speak. So what we kind of want to do is we want to take all that information that's available to us via that HL7 order message and somehow pass this on to the imaging device so that the technologist does not have to enter everything on their end once again. The way we're going to do this is we're actually going to utilize a worklist provider. Now, what worklist are we talking about here? Because there may be different ones. Of course, in this essence, we're talking about a modality worklist. So that's a DICOM service that allows taking rather incoming HL7 information via an ORM message, and then converting it to DICOM and then passing this on to the respective modality. Now, what we're going to do is we're going to connect our RIS to the worklist provider. Now you can see that within our network builder, we get this little pop-up, which basically prompts us to select the proper connectivity method. Now the RIS is going to be sending information to the worklist provider using HL7 version 2. So we're going to select it. We're going to say check and connect. And yeah, that's correct. That's good. So now this worklist provider in turn, what this is going to do is it's going to actually convert that information to DICOM, and it's going to provide that information to one of the devices. Now, let's suppose our patient's here for a chest x-ray, so we'll put maybe a CR reader. This is a clinic, maybe they're using some kind of older equipment, whatever, that's fine. But we're going to take our worklist provider and we're going to connect it to the CR reader. Now, remember that what we've done within that worklist provider is we've converted HL7 to DICOM. And so that is exactly the avenue that we're going to use to connect the two. So the information is going to be passed on to the CR reader, in our case, using DICOM. Now, of course, the reader, just like any acquisition device, would request it, and the worklist provider would provide what's called a C-find response. But nonetheless, it is very much so a DICOM connection. Now, at this point, let's think back to the workflow. What's going to be happening? Well, the technologist at this point can simply walk up to their device, click on the worklist button, and they would see a list of all the patients available to them today. Now, at this point, what they're going to do is they're going to select the patient they're about to bring into the room. After that, it's pretty much smooth sailing. They're going to go into the room, into the waiting room, excuse me, get the patient, confirm their identity, bring them into the room, and do the actual imaging. That's a given. Now, okay, after the imaging is done, what are we going to be doing next? Well, we got to send those images to PACS, don't we? So let's bring in our next actor. This is going to be PACS. Now, how is the modality going to connect to PACS? Well, it's going to connect using DICOM, isn't it? We're going to specifically use a command known as cstore to send images over to PACS. And that is indeed correct. So now we have our connectivity set up from our acquisition device, the CR reader in this case, over to the main PACS. Now, the PACS itself is where the images are going to be stored, but the main reason behind doing all of this is so that we can get the study reported. So I guess we better bring in a reporting workstation into the mix here. Now, how is the reporting workstation going to communicate with PACS? Now remember, PACS is a DICOM device, so certainly it can communicate using DICOM, but in this case, DICOM is not even necessary because what we're going to do is we're going to use a proprietary means of connecting this. Remember that your reporting workstation most likely is just an extension of your PACS, so there's probably a local client sitting right on that workstation. So in this case, it can be a proprietary connection. Now that's great. On that reporting workstation, the one thing that the radiologists are going to do is they're obviously going to open the study and they're going to review it. That's fine. But they're also going to use dictation software. Let's place it maybe somewhere here. Now, this dictation software, make no mistake, in most cases, it lives, so to speak, on the same workstation as, the PACS client itself. But it is a separate device, so it's important for us to denote how that connectivity is done. And the way a dictation software, even installed on the same workstation, speaks, if you will, to PACS is usually by means of local integration. Not the only mean, but it's a very common one. All right, so now we've got it all connected. Now, remember one more thing. Dictation software is probably going to need its own connectivity to the RIS. Now, the connectivity is going to be done via an HL7 route. And I do want to say that this is a bit oversimplified because truly the RIS is going to talk to the server, but let's just connect them nonetheless. This is more conceptual in its nature, but this is indicating that there is an HL7 pipeline going from the RIS over to the dictation software. Now that part's correct. And then this dictation software is going to have to send stuff back to the RIS. Yes, of course, that would be the radiologist report, which is what we're calling the ORU message. So dictation software going over to the RIS, once again, sending an HL7 message. So that it all started with HL7, only makes sense that it all is going to end with HL7 as well. And so there we have it. So we've got our main RIS going over to Worklist provider. By the way, what is a Worklist provider? Well, it can be different things, right? It can be your PACS that has this functionality. It can be your RIS or part of your EMR that has that functionality. Or maybe it's a dedicated broker. That's also very possible. And what this thing is going to do is it's going to provide modality worklist to different devices. We are using CR Reader as an example, but you can just as easily put in whatever you want. Maybe you also have a CT scanner. Well, this worklist provider can connect to the CT scanner as well. And once again, the language of connection will be DICOM. Now, ultimately, any device, whether it's this CT or whether it's the CR reader, is going to send stuff over to PACS for storage. It's always going to be DICOM, and that's exactly what we have out here. Main PACS is going to communicate to the reporting workstation. That workstation is going to run the dictation software, which ultimately is going to send that ORU message back to the main RIS. And then from there on, how that gets to the actual referring physician, to the physician that actually requested this order, well, that depends, right? There's different routes. It may be sent electronically, it may be sent via mail, it may be sent via fax, it all depends. But this is the main setup as it relates to the legacy, the conventional, if you will, network diagram. Thank you for watching. Subscribe for more videos just like this.